I was informed that they found a gene in me. The gene had caused a bruise on the edge of my kidney, and that's how I ended up in dialysis. With the blood pressure research, the research team came to me. They asked me to participate, and I participated, knowing that, in time to come when I'm gone, that whatever is researched now would be of help for people who will come along the way.
We're doing a really exciting study right now. It's called the Home Blood Pressure Study. Blood pressure is probably one of the most important things that we can treat as nephrologists. We know that high blood pressure is linked with poor patient outcomes. Patients don't feel well, they have shorter survival, and more likely to develop heart disease. Currently in clinical practice, patients have blood pressure measured really frequently when they come to get their dialysis treatments. However, we think that blood pressure measurement right before dialysis may not be the best one to give us insight in terms of what the patient's blood pressure really is on a normal day. And so for that reason, we're testing the hypothesis that measuring and treating home blood pressure may be a better alternative. So we've given them a blood pressure machine that they go home and measure their blood pressure, and it syncs with a tablet.
The pressure is taken 3 times, and it goes to UW. It's educational in a way for me, yeah. So there are questions that come up, and when I take that to my nephrologist, and every day it's from the blood pressure machine, and that's transferred to more I know I understand.
It's outside of dialysis, but they are having an opportunity to take extra autonomy over their health.
This study requires some knowledge and comfort with using technology. And what this has highlighted is that there's a technology divide that we're observing in our patients. We're seeing this in patients who are racial and ethnic minorities, those who are older in age, for example, who have issues with ability, dexterity, and then social advantage. And I think this is really highlighted to us as a study team that the idea of disparities is much broader than what we just initially anticipated. The idea of race and kidney function is quite complex. Historically, we've estimated level of kidney function by using an equation that incorporates a patient's race to give you an estimate or quantification of what the level of kidney function is. And so we did a study in which we looked at the impact of whether we estimated kidney function with versus without including a patient's race. We found that by including race in the assessment of kidney function, it was on average delaying a patient's eligibility for kidney transplant by almost 2 years. Nationally, UNOS, which is the organization that makes rules about transplantation in general, have really recommended now that we don't include race in the assessment of kidney function when looking at eligibility for kidney transplant. Having equitable access to transplant is so important for our patients.
I really enjoy working with all of the patients and seeing the progress that we're making. We can already see such huge benefits to their well-being and improvements in their blood pressure, also just improvements in general health literacy. I feel like I'm making a difference in these patients' lives.
Northwest Kidney Center is a partner in everything we do. They help us in every aspect of our studies, from idea conception to leadership to financial support to actually recruiting patients directly from Northwest Kidney Centers. So I can't imagine doing the work we do without their support.
The care here is just beyond, and it's just amazing. And to understand that these are folks who are financed through donors is just beyond me, yeah. The only thing I can say is thank you. Thank you, yeah. Thank you, and if you're watching it.